हेलो एवरीवन एंड वेलकम बैक टू माय प्लेलिस्ट ऑफ पैथोलॉजी। हम मीडियम रॉबिन्स है। पैथोलॉजी का चैप्टर जो जेनेटिक्स एसोसिएटेड है, दैट इज़ व्हाट वी आर डिस्कसिंग एट द मोमेंट। एंड आफ्टर डिस्कसिंग अ लॉट ऑफ डिसऑर्डर्स, टुडेज टॉपिक इज गोइंग टू बी म्यूकोपॉलीसैकेराइडोसिस। एज द नेम इंडिकेट्स, हम अभी तक जो लाइसोसोमल स्टोरेज डिजीजेस कर रहे हैं, नेम most of the time gives it away. So in this disorder, what will be increased in quantity? Mucopolysaccharides. Okay, so this mucopolysaccharidosis, जिसको मैं रेफर करूंगा आपसे MPS, they are characterized by defective degradation and therefore excessive storage of what? Of mucopolysaccharides. So obviously you have mucopolysaccharides in your cells and body, and these are degraded. And if there is problem with the degradative enzymes, then they will not be degraded. So their degradation will be affected and their levels will go high. And this is what MPS is all about, okay? Now recall that mucopolysaccharides are part of the extracellular matrix. They are usually present outside the cells in the extracellular matrix. They are synthesized by which cells? By fibroblasts, which are present in the connective tissue. And most of the mucopolysaccharides which is generated is actually secreted, but there is a small fraction which is degraded, which is taken up by the cells first and then degraded by the lysosomes. अब अगर लाइसोसोम में कोई ना कोई एंजाइम मिसिंग है तो इनकी डेग्रेडेशन अफेक्ट होगी और फिर ये जो म्यूकोपॉलीसैकेराइड्स हैं, they will be stored within the cells, right? This is what will happen. And now there are several different variants of mucopolysaccharidosis. So for example, MPS 1, MPS 2, 3, 4, 5, 6, 7 have been described, each resulting from deficiency of a specific enzymatic pathway, right? Because there are different steps of degradation, there are different variants of mucopolysaccharides, and therefore there are different enzymes. So for example, MPS 1 में जो enzyme deficient होगा, that will be slightly different from the one which is deficient in MPS 2, but at the end there will be increased mucopolysaccharide, there will be decreased mucopolysaccharide degradation. Okay, now the common mucopolysaccharides which actually accumulate within the tissues include heparin sulfate, keratin sulfate, and sometimes also chondroitin sulfate. Okay, and if they are accumulated in, for example, liver, then there will be heparosplenomegaly. If they are accumulated in the somewhere in the skeleton, there will be skeletal deformities. Also in the heart, there will be subendothelial arterial deposits of mucopolysaccharides. So these are all the range of organs which are affected. In many of the more protracted syndromes, coronary subendothelial lesions. So if you know, coronary subendothelium is a very important area जहाँ से oxygen reach करती है myocytes को. If that is the area जहाँ पे ये accumulate हो जाते हैं, then there will be risk of myocardial infarction and ischemia. And therefore MI is one of the sequelae for these disorders if cardiac subendocardial area is affected. Now most cases are associated with coarse facial features, clouding of the cornea, joint stiffness, and mental retardation. So that's a lot of symptoms there. Urinary excretion will also be noticed because there are increased levels of mucopolysaccharides. Okay, now there are a few which are very important for examination purposes and that you have to remember. Although there are so many, but at least those few you must remember. So और उनके फिर अच्छे fancy funny से नाम हैं, और चूँकि मेडिसिन में इस तरह की चीज़ें एग्जामिनर्स को बहुत अच्छी लगती हैं. So mucopolysaccharidosis type 1 for example is also called Hurler syndrome. Sorry, the Hunter is type 2. Hurler syndrome, and it is caused by deficiency, और इसका एंजाइम आपको पता होना चाहिए कौन सा एंजाइम डेफिशिएंट है. So that particular enzyme is alpha L-iduronidase. What a difficult name, bro. In Hurler syndrome, what happens कि affected children have a life expectancy of only 6 to 10 years. Oh, poor kids. And death is often a result of cardiac complication. Okay, accumulation of dermarin sulfate and heparin sulfate is noticed in the mononuclear phagocyte system and in fibroblast within the endothelium of the smooth muscle vascular wall, also in the heart. So these are the areas affected. Hurler syndrome, this is the enzyme affected. These are the mucopolysaccharides which increase. Okay, life expectancy is very low. The affected cells are swollen because of accumulation of these mucopolysaccharides, and obviously there are some stains which you can use to identify them. It can be very positive with PAS, periodic acid shift staining. Okay, and lysosomal inclusions are also found in neurons, accounting for mental retardation, because these are the different cell types जहाँ पे mucopolysaccharide accumulate होगा. Type 1 Hurler, Then we have type 2, which is called Hunter syndrome, and it actually differs from the Hurler syndrome in its mode of inheritance, X-linked inheritance. Okay, now the absence of corneal clouding, and often it's milder clinical course, so it's a little milder as compared to what we see in type 1. As in Hurler syndrome, the accumulated mucopolysaccharides here also are heparin sulfate and dermatan sulfate, but this results from deficiency of sulfatase enzyme. Here the enzyme was iduronidase. Here it is iduronate sulfatase, a different set of enzyme and a different set of disorder therefore. Okay, despite the difference in the enzyme deficiency, accumulation of the identical substrates occur because breakdown of the heparin sulfate and dermatan sulfate require this not very high yield discussion here. Just remember what is the mode of inheritance, what is the name of type 2, what is the enzyme deficient, what are the substrates which are accumulating. Diagnosis is made by measuring the levels of enzymes in the leukocyte, but now we have genetic sequencing by next generation sequencing techniques. So NGS is also something that we do these days very commonly to identify these disorders. Okay, so small short टॉपिक लेकिन एग्जाम्स के लिए इम्पॉर्टेंट. नेक्स्ट डिसऑर्डर हम डिस्कस करेंगे ग्लाइकोजन स्टोरेज डिजीजेस.